Sterimed, one of the pioneers in medical and surgical devices, brings to you the latest in all-silicon Foley Balloon Catheters. Bladder Health Model BH. This innovative product is designed to maintain bladder health while making the experience less traumatic for patients. Normally, silicone catheters are used on patients who require catheterization for long term, sometimes 6 to 8 months or even more. During this period, the urine is being drained continuously, hence the bladder muscles are not being used. The muscles of the bladder become weak due to non-use for a longer period. When the patient recovers and the catheter is removed, patient will feel like urinating always or might even have constant dripping due to weak bladder muscles. Sterimed Model BH helps counter these problems by providing a flow-controlled clamp as part of the catheter funnel. The clamp can be kept closed under normal circumstances to allow urine to collect in the bladder, creating pressure in the bladder muscle. When the patient feels an urge to urinate, the clamp can be opened to allow the urine to drain out in a normal urinal. If the patient is not in a position to inform about the urge to urinate, the catheter can also work as a normal all-silicon Foley balloon catheter. Connected to a urine collection bag or a periodic clearance of urine may be advised to the patient. Model BH removes the necessity of having a urine collection bag connected to the tube at all times. This not only allows patients added mobility without having an attendant to carry around their urine bag, but also makes it convenient for them when taken out for tests, scans, or examinations. Under normal circumstances, bladder training is required when the catheter is about to be removed. The catheter is normally knotted or physically clamped to block urine flow through the catheter so that bladder can be filled before emptying to allow the bladder muscle to function properly after the removal of catheter. This training is by default provided with our catheter that has a flow control clamp. Almost all available silicone Foley balloon catheters in the market today have a high friction surface due to the inherent property of silicone rubber. However, Sterimed silicone Foley balloon catheter has been specifically treated to provide a low friction, self-lubricated surface. The catheterization is definitely less traumatic for the patient. Normally, a lot of silicone catheters have a major problem of balloon tearing after inflation in the bladder. Sterimed all-silicon Foley balloon catheter uses a very special silicone elastomer to make the balloon. The elastomer has a very low durometer and a very high elasticity. This means that the balloon will need very little force to inflate it and will not tear easily when inflated inside the body. 4 chief advantages of using Model BH are: 1. Helps bladder muscles to function normally. 2. Lowers the risk of infection by avoiding the use of urine bag. 3. Lowers the risk of balloon tearing when inflated inside the body. 4. The lower friction of the surface reduces trauma during intubation and extubation, hence making the catheterization experience more patient-friendly and reduces anxiety and injury during catheterization. At Sterimed, our vision is to innovate for tomorrow, which keeps us focused on improving patient care. We offer a wide portfolio of over 100 world-class products with a strong focus on quality and excellence. Sterimed, innovating for tomorrow.